Talk about, again, what is happening in Western Australia. The Health Minister, Roger Cook, is also the Deputy Premier. He is a bloke who should take absolute responsibility for the little girl we told you about last night. A little girl who wanted to go to an emergency ward, but because of the problems in emergency wards in Western Australia, she was turned away. She later died. Her family, wanting to get answers out of the government, went on a hunger strike. They stood out the front of the hospital, and only because they did that, we got a report into her death. One that, of course, concludes it was completely unneeded, completely avoidable. Yet an apology is the best that you can get from the Health Minister, because, of course, the Health Minister doubles also as the person who's the go-to when it comes to coronavirus in the freshly re-elected and massively re-endorsed Labor government. But under this Health Minister's watch, while they've kept everyone safe from COVID by telling people they can't come from the rest of the country, the number of people who have been turned away from emergency wards in Western Australia has grown. The idea that a little girl died because of the failures of a health system that this bloke put in place means this bloke should go. But most likely he will be protected by a Premier who knows that eventually he can bat out any scandals, and this is going to be, yet again, one of the consequences of an opposition being pushed down to just 2 people in the West Australian Parliament. They can effectively ride out most scandals because question time nobody pays attention to. You probably couldn't even name who the opposition leader is in Western Australia. This bloke should go out of decency. And also, in the 5 months leading up to the state election, where they got such a wonderful rubber stamp for how amazing the health system was when it came to COVID, when the actual system didn't work and contact tracing meant that we got the endless shutdowns in Perth. Ramping has got worse every month for 5 months. What's ramping? It's when you get in the back of an ambulance, but the ambulance can't take you to a hospital and can't take you from the back of the ambulance into a hospital, into an emergency ward because they're full. This bloke is all noise, no action. If there is any decency whatsoever in the Emperor, this bloke must go as the Health Minister, and go now. But you know, and I know, he'll just bat it out. Meantime, in Queensland, where this week alone, they've announced an extra $100 million to help deal with their health system. Remember, world class, thanks for keeping us safe, but it's had an awful lot of problems. There is demands for the government to give apologies to yet another young person, because the claims that being made by the minister about this person was that the health issues were made up. They weren't. Keep an eye on the detail. Keep an eye on consequence. Because while, yes, COVID is the big issue, yes, has been the issue that we care about the most, people get sick for lots of other reasons. And healthcare systems are not working in parts of the country because they become overly obsessed about a disease that 99.9% of people, A, would not die from, but B, was not having elective surgery for month after month after month, because we had to make sure that all of the hospitals were empty in case there was an outbreak. Of course, when it came to Western Australia, there wasn't going to be an outbreak because no one was allowed to travel into Western Australia. When it comes to Queensland, they spend all day, every day, blaming the federal government. This is a state government responsibility, health, a state government failure by 2 bad state governments, both Labor. Don't forget it.